Good morning, ladies and gentlemen. I want to welcome you all to the 9th Trauma Management course here in JUT. I'm Dr. Okafor Kingsley C, and I'm here with my colleague, Territorial Manager for Ethicon Johnson & Johnson, Kayode Taiwo. Today we'll be going through together and quickly, for that matter, the world of hemostasis. I'm sure it's a very familiar terrain for surgeons and those that are into management of trauma. So we'll be going through it together. Using this outline, we're talking about the importance of surgical hemostasis. We'll look at traditional techniques. We'll look at factors in choosing the right hemostat or sealant and the physiology of hemostasis. We'll eventually go to the overview of the different technologies available to control bleeding. And we'll look at the J&J Ethicon biosurgery portfolio. Sorry. Yes, at Johnson & Johnson, we believe our first responsibility is to our doctors and the other healthcare workers that use our products as end users. We also believe in ensuring that the patients get the best quality product as much as possible, and to ensure that the outcome of surgery is the best. Now we'll be looking at surgery and blood loss management. You'll agree with me that optimal surgical technique depends on how you manage your blood loss. And effective blood loss control can be used to avoid problems like impaired intraoperative visualization, prolonged operative time, increased length of hospitalization, hemodynamic deterioration, hypovolemia, and anemia. And also it can increase the exposure to blood component transfusion. Next. You all agree with me that even blood transfusion has its negative consequences. And we also know that there's an increase or post-operative infection after blood transfusion. There's a possibility of that. To blood loss. There's longer operative time. There's the cost of increased mobility during blood loss. There's increased reoperation rates and the cost of blood transfusion. Now, there are traditional methods of hemostasis. First, you look at the mechanical method using hemostatic clamps, ligating clips, staples, sutures, bone wax, tourniquets. For pharmacological methods, you can have systemic, local, or prophylaxis. For prophylaxis, one use erythropoietin, which is usually given to patients that probably have been heparinized. Now, you can also have blood transfusion or blood salvage method. It can be the transfusion either from the patient himself or from a donor, either autologous or allogenic. You can have cell saver, you can have hypotensive epidural anesthesia. Now, there are situations where hemostasis may not be effective. When there's diffuse bleeding when there's a broad surface area, when bleeding is from an isolated source, and when the isolated or diffuse bleeding from a poorly visualized source, especially when you're doing a laparoscopic procedure, and when you have isolated or diffuse bleeding from an anatomical location that is difficult to access. Now, to control bleeding effectively, the best choice needs to be made in each situation, and there are many factors which affect the method chosen. The severity of the bleeding will decide which kind of method you want to use.